Hello everyone, this is Dr. Maha Abdurrahman. I'll be explaining today the blood vessels are as part of the circulatory system for the IGCSE biology, and this is friendly with the Oxford AQA, EdXL, and Cambridge as well. So the type of the blood vessels is arteries, capillaries, and veins. And if we look at the structure mainly of the artery here, we will realize that the structure is adapting with the function. So the structure of the arteries that carry the blood away from the heart. So always guys, artery for away. So these are blood vessels that carry the blood away from the heart. That means the blood should be under high pressure, under too much pressure. So we will see that the structure is complementing the function. If you look here in the wall of the artery itself, you will find that it's a very thick wall, okay? And there's as well big layer of elastic fibers. This comply with the function, which is transporting the blood under too much pressure. So the thick wall is to withstand the high blood pressure. The elastic fiber is to allow the artery to stretch and recoil back every time the heart is pumped. On the other hand, if you notice since the thick wall and the elastic fiber are taking a huge place in the diameter of the artery, then the lumen of the artery will be relatively small lumen. Okay, so that's about the structure of the artery and how is it adapted for the function. If we move to the structure of the veins, okay, we will see that veins are blood vessels that takes the blood back into the heart. So in for into, so it takes the blood back into the heart, okay. And for the veins, if you notice that the wall is not very thick, it's actually a thin wall, okay. Also the elastic fibers are less, so they've got less elastic fibers, okay. And the reason for this, because when the blood finish or comes toward the end of its journey going back into the heart, this blood should be under low pressure. That's why the wall is thin, less elastic fiber. There is no much pressure exerted in the veins. That's why you will see here the lumen is bigger than the arteries, okay. This allowed to help the blood flow despite the low pressure. But there is a very important structure in the veins that allow the blood to go back go back to the heart without moving in the reverse direction. This structure is the valves. Okay, so you will see arteries are full of valves, as you see along the veins. Sorry, I said arteries, veins. Veins are full of valves. Okay, along the diameter, along the length of the veins. Okay, these valves, they help the blood to move in one direction, okay, and prevents it from going back. So that's why veins has valves to help the blood moving in the correct direction back to the heart, prevents it from going back. Then if you notice, there is a third type of blood vessels, that is the capillaries. Now the capillaries is the junction between arteries and veins. And so how it goes, blood moves from the heart to the arteries, then to the organs or the tissues, and then when it comes next to the organ or tissues, these arteries will give capillaries. Capillaries are really small, okay. Why the reason they're small? With their wall is very thin, it's only one cell thick. Why? To allow diffusion of oxygen from the blood inside the capillaries to the tissue. In the same time, the capillaries will take back the carbon dioxide, okay, from this tissue back to the capillaries, and then from the capillaries to the veins, and then from the veins to the heart. Okay, so to allow and facilitate diffusion, the wall of the capillaries has to be very, very thin. It's 1 cell thick to support with this. Okay. Also, we will see that the wall are permeable so that substance can diffuse in and out. And we already mentioned about the path of diffusion, that is 1 cell thick. This increases the rate of the diffusion by decreasing the distance over which diffusion has to occur. All right. So that was about the structure of the arteries, capillaries, and the veins, and how is it adapted for its function. Now, if I need to move further for the talking about some cardiovascular diseases, some problems that may arise for the heart. We have already explained the circulatory system and how that heart is the organ that pumps the oxygenated blood to the whole cells. Then these cells will use this oxygenated blood along with the glucose that will diffuse to the cells as well for aerobic respiration, produces carbon dioxide that will be given back to the capillaries, from the capillaries to the veins, from the veins back to the heart. But we did not mention the part of which blood vessels supplies the heart itself as an organ, because look at this heart. Heart is an organ. Heart is a muscle. Heart is a big muscle that still requires energy to move and to contract. This energy is supported as well by aerobic respiration from the heart cells. So what's the name of the blood vessels that provide the heart as muscle with the blood? Okay, it's called coronary artery. Coronary artery are the arteries that provide the heart itself with the oxygenated blood. Okay, and there are also coronary veins that take up the carbon dioxide and the waste from the heart as muscle. And the problem will arise when these coronary arteries are blocked. What could be the reason that may block the coronary arteries? It is the deposition of fatty material inside the coronary artery. Why this may happen? Because of unhealthy lifestyle, obesity, diabetes, smoking, many reasons, sedentary lifestyle, many reasons may cause the blockage of this coronary artery partially or fully. So the problem with this blockage, as you see, so that's a normal artery, okay? This is a partial block with a deposit of fat that builds up inside the coronary artery. The blood, it is harder for the blood to pass through this blocked artery. This may lead to problems like heart attack. So what could be a solution that may remove these fatty deposits? One of the solutions is called stent. Stent are tubes that are inserted inside the arteries. Stent is, this is how the stent looks like. It's a wire mesh tube, okay? It is a wire mesh tube. Now this wire mesh tube is inserted by a catheter that has a deflated balloon inside. Once this enters inside the coronary artery, the balloon will be inflated. So this is how it will be. The balloon, so that's the wire mesh, okay? And the balloon will be inflated, right? so that the wire mesh is fixed inside. I'll draw the artery with maybe black color. So that's the coronary artery, all right? So now this stent is attached to the coronary artery. And how about the fat deposit? That was the fat deposit. It's now embedded and collapsed by the wire stent. So the pathway now is open for the blood to move. Of course, after that, this balloon will be removed. Okay, so this balloon will be removed, allowing only the stent to remain inside. Okay, so that's the stent remaining inside, keeping the coronary artery open at all the times. Okay, so as we see here in this diagram, the stent pushes the artery wall, squeezing the fat deposit and squashing it, so more space in the center for the blood to move. Okay, so that's a good way. The use of stents is a good way of lowering the risk of heart attack for people with coronary heart diseases. This is very effective for a long time, and the recovery time is quick because this is not a surgery. Okay, so it's not a major surgery. Okay, it could be just done by a catheter. So on the downside, there is a risk of complications during the operation, and there is a risk of infection as any other surgery. There is a risk of, as I said, that's not a major surgery, but still there is a risk of infection because of the catheter use. There's also a risk of the patients develop blood clot. Why? Because this stent is still a wire, right? So a lot of blood may deposit here, guys, within the mesh itself, okay, causing something called thrombosis. Thrombosis is a blood clot that may prevent the blood from moving and passing in the correct direction. So that's the pros and cons for the stent use. And one other problems that may arise for problems with the heart is when your heart fail. What do I mean by the heart fail or heart failure? When the heart cannot pump blood around the body. So the solution in this case, so that's a different problem than the stent. The stent, I'm using it to help with the problem in the coronary artery. But here the whole heart is not working. So the best thing to do is using artificial heart. Artificial heart. These can pump the blood around the body. Okay. Artificial heart is not a natural heart. That's a synthetic heart, like a man-made heart. Okay. So these are good. These artificial hearts are mechanical devices. As I said, these are man-made. They're not natural. They pump the blood for the person whose own heart has failed, as we said. They're usually only used as a temporary solution. Why I'm saying as temporary solution? This is not a long-term solution. The long-term solution is to find a donor where this donor can donate his heart. No one can donate his heart, right? So this donor may be a recently dead person where he has given authorization to donate his heart, okay? Which is, as you see, not easily applicable solution. We won't easily find a fresh dead person that has donated your heart to you and then the tissues was matched. So that's not an easy solution, right? So until you find this donor, then to keep this person alive, or this patient alive, until a donor heart can be found, then we will use this artificial heart as a temporary solution. Okay. In the main advantage of this artificial heart is that it's less likely to be rejected by the immune system, since it is an artificial heart, not from a real donor. It's made up of metals or plastic, so the body does not recognize them as a foreign bodies, and it will not attack them, unlike if this heart was donated from someone else who the tissue is not perfectly matched. The main problem, that's the advantage of the artificial heart. The disadvantage is that to fit this artificial heart, we need a big surgery. Okay, so this surgery may lead to bleeding, infection. Also, this artificial heart needs maintenance. It's a device, right? It may wear out. The electricity may fail for a reason or another. So all of these are problems. Also, it may also, just like the stent, promote the formation of blood clot. Okay. So also I need to give this patient drugs to make the blood thin all over his life. Okay. So that these blood clots won't form around or inside the artificial heart. So that was one of the solutions for the problem. The second solution for a different problem, to be honest, which is the problem of having faulty heart valve. This is a different problem. So the heart is working, the coronary arteries are good, but the valves within the heart itself are not working. Okay, just to show you guys where are the valves within the heart. If we look here, just a second. Yes, here we go. So if you look here, there are 4 valves within the heart. Valves between the left atrium and the left ventricle, which is this. All right, and there are other 2 valves here between the left ventricle and the aorta, and the right ventricle and the pulmonary artery. So again, what's the function of these valves? These valves, guys, they help to move the blood in one direction, which is from the atrium to the ventricle, and prevent them from going back. Same thing here, so they help the blood to move in one direction from the ventricle to the aorta and to the pulmonary artery, and prevents it from going back. So what would happen if these valves are not working, faulty valves? I should replace them. I should replace them whether with a biological valves, that means it's coming from another human being or another animal, or by artificial valves that are also man-made. So these are the 2 solutions for the faulty valves. It could be replaced with either biological or mechanical valves. Okay, so what causes these valves to deteriorate in the first place? It could be damaged or weakened because of old age, mainly infection, heart attack. There are many reasons. So they're not working properly. Sometimes they may leak, allowing the blood to flow in both directions, not only in one direction, as I explained. So this means that the blood does not circulate effectively, which will affect your whole performance. So severe valve damage can be treated by replacing the valve either with biological valves. From the name, biological means it's coming either from other human, as I said, or from other animals, just like cows or pigs. They have similar valves to the valves present in our heart as a human. Or they can be replaced by a man-made valves that are mechanical valves. Now, replacing a valve is much less drastic procedure than the whole heart transplant. This goes without saying. Okay, but fitting artificial valves is still a major surgery, and there can be still problem like blood clot, like infection. Whenever there's a major surgery, you're talking about the risk of infection, and the blood clot is very high. Okay. Artificial blood is not in the curriculum of Oxford EQE, neither the EDXL or the Cambridge, so I'm not going to do this today. So that was a quick revision for the different type of arteries and veins, and for the different problems that may arise in the heart, like artificial valves, like artificial heart, and also just like the stents that are used to cure the problem of fatty deposition in the coronary arteries. I hope this was beneficial from everyone. Thank you so much.